Hello, my name is Matt Baker and I'm an educational and child psychologist. Along with colleagues, I've been working closely with Operation Encompass for some time now, overseeing research into therapeutic support for children and young people who experience domestic abuse. This is a short video offering guidance to officers attending domestic incidents where children are present and where the officer or a colleague is likely to be contacting the child's school after the incident. It offers guidance on the behaviours young people and children are likely to show, information which can be very useful if reported back to school. It also provides a brief overview of what we know about the impact of domestic abuse on young people and refreshes a couple of key questions to ask parents during the current challenging period of lockdown and social isolation. A little bit about context before we go any further. This presentation has been compiled by myself and colleagues, all of whom are psychologists. As such, we're experts on psychological well-being, behaviour, and the various factors and experiences that make children, and people more generally, the way that they are. We've never done your job and should make it clear from the beginning that we're not trying to tell you how to. We can only imagine the complexity of arriving at a potentially violent incident and attempting to calm the situation and make sense of what's happening. We appreciate that asking you to notice more at this time may be challenging and can only emphasise that this is about doing what is possible. Anything noticed, any information passed back to schools may ultimately make an enormous difference to the life chances of the children in that household. In supporting that, your role is absolutely key. I should add that although this film recaps a few key points about Operation Encompass, it's not an alternative to attending appropriate training regarding what that organisation does. However, just as a brief overview, Operation Encompass are a charity who have sought to build a safeguarding partnership between police and schools. Their primary purpose is to ensure that when police are called to incidents of domestic abuse where there are children in the household, the schools attended by those children receive a call from police informing them of this before the child or children arrive at school the following day. As you probably already know, each police force has an officer who acts as designated lead for this, and if you have any further questions after watching this film, that officer should be your first point of contact. Firstly though, why does it matter? That might sound like a question with an obvious answer, but it's worth briefly thinking about the impact of domestic abuse on children and young people. To put it simply, this is a much wider spread issue than many people realise, and one that has severe and often long-term consequences for the young people involved. We know that at least 1 in 5 children have experienced domestic abuse at some point in their lives. If we think about the size of the UK population, that means at least 2.6 million children. Scary as that figure is, we also know it's an underestimate, given that much domestic abuse never comes to light. That's about size, but in terms of consequences, it's important to recognise that what this does to children. There's been a lot of research in this area now, and we know that young people exposed to domestic abuse suffer in all sorts of ways. We know they often live in fear and are more likely to be neglected or abused themselves. We know they often struggle to sleep, to maintain friendships, and often suffer attendance problems. They frequently do worse at school and are more likely to suffer with a range of difficulties such as anxiety and depression. Over the longer term, young people brought up in households where domestic abuse occurs are more likely to develop what can become lifelong mental health difficulties. They have poorer job prospects than peers and are at greater risk of self-harm or attempting suicide. Some suffer long-term neurological difficulties through the impact that this level of stress is known to have on brain development. Probably important at this point to add a note of hope and say that the reason we're talking about this is that we know that some relatively minor acts on your part, on our collective part, can ensure support is provided and can make a very real difference. Communication and information sharing is absolutely vital, and that means you to parents, you or the appointed officer to school, and so on. It's worth remembering that child protection overrides confidentiality at this point, although if you're not clear on what we mean by that, it will be worth clarifying with your lead officer. Put simply, there is no barrier to sharing information when we're concerned about a child or young person. Obviously, stopping the abuse is key to improving the situation, and so obvious we often don't mention it, but it does need saying. Abuse stops because of good communication, because it is no longer hidden, because of support, and as a part of that, due to our next point here, which is early intervention. Early intervention just means getting in there as soon as possible and working to address a problem before it becomes long-term and entrenched. The sooner we change things, the less damage is done. By noticing what is going on, reporting what we see to schools and relevant colleagues, and by asking parents the right questions, this is what we're supporting. In terms of what that intervention consists of in school, is what I often term small T therapy. It's not immediately about psychologists or therapists, but known adults, teachers or teaching assistants, who can build a relationship of trust with an often scared child, who can be there to meet them when they get to the school the day after you or a colleague have rung through the fact that an incident happened. It's about giving them time, helping them express their emotions, and letting them know that someone cares, making school a strong and caring place for them when home isn't. And then there are other forms of support that matter, but these tend to come later. Family support can be absolutely key in these situations, as can therapeutic support, be that for the child or for the family more generally. So, what are we talking about in terms of things it's useful to notice and how both the child or home appear? Well, it's worth starting by saying that we're talking about both people and environment. We'll be going through these in a bit more detail as we go along, but in outline, this is about noticing the home and what is in it, who is present at the time, what time of day it is. It's about noticing physical factors such as marks and how people are dressed. Then, and we're particularly thinking about the young people present throughout this, it's about noticing behaviours and how young people are behaving. Breaking that down a little bit, we need to think about who is present in the house and why. If it's a working day and a school day, and one or both of parents or carers have jobs, or a child is present, then what's happening? And are there other people there? If we know children are present, have we seen them? If not, why not? I'm not an expert on what you're allowed to do, and I certainly wouldn't be getting sleeping children out of bed. But if possible, I would certainly prefer to see them and know that they were there and safe. If your visit takes you into kitchens or bedrooms, is there evidence of food in the house and of a child having a bed? Similarly, is this a house that looks like a child lives in it? Are there toys and games around? This is information that can be very important to pass on. Extending that a bit, is there furniture and are there other belongings around? If not, how temporary is this? Some families have few belongings and some move regularly for good reasons, but frequent and often sudden moves of both home and school are common signs of domestic abuse, as the abuser seeks to stay one step ahead of the authorities and the neighbours. We've already mentioned clothing briefly, and it's certainly worth noting how people are dressed. I'm mainly thinking about the children here, but others as well. Are there obvious marks or bruises? Most families have days where everyone's still in their pyjamas by the afternoon, but if it's a school day and other things seem a bit strange, what does that say? Similarly, a child wearing long trousers, long sleeves and multiple layers on a hot day may just have chosen to dress like that, but long clothing can be there to cover bruises or marks. On its own, it may not mean anything, and it's probably important to say don't react to every little thing if there's no evidence, and that we can't make someone undress. But it may well be information to note and pass on. By the same token, are there obvious bruises and cuts? Most active children have some virtually all the time, but they're usually on obvious places such as elbows and knees. Bruises on soft flesh, such as the inner arm or thigh, don't happen quite so easily. And whilst bruises or marks may not mean anything, they are again information that needs to be noted and passed on. I should add at that point that if you have immediate concerns, then your local child protection and safeguarding procedures obviously take over, and you must act accordingly to make sure that that young person is safe. And then behaviours. It's worth just pausing and thinking what the word behaviour means. After all, we all behave all the time. It's something we can't avoid doing, but it's not something we necessarily think about. Behaviour almost always reveals something about how we're feeling. It is often about getting a particular response from someone or getting our needs met. That doesn't mean it's necessarily manipulative though. Even smiling is designed to provoke a particular response. usually to communicate positive feelings and to make communication comfortable and friendly. Scowling or looking stern has a similar, opposite purpose. However you view it, behaviour always communicates something about what a person is doing, and usually about how they are feeling, even when they don't want it to, and as such it tells us quite a lot. The type of behaviours we're talking about here are the ones that might give us a reason to be concerned about someone's well-being, and although this is a simplification, they're often divided into two types: internalising behaviours and externalising behaviours. Internalising behaviours are those that involve withdrawing and turning in on the self, whereas externalising behaviours are those that involve what is often called acting out. In other words, acting out your pain or trauma. We're talking about internalising behaviours here first simply because they're always talked about second, and as a result they tend to get forgotten even though there is much a source of concern when we're thinking about children's well-being as more obvious externalising behaviours. Internalising behaviours can simply involve being very quiet and withdrawn, avoiding engagement and appearing very passive. They may involve avoiding leaving home and avoiding going to school. It's important, incidentally, to remember at this point that it's perfectly normal for small children with no particular traumas or challenges to appear nervous of strangers and peer at you from behind their parents' legs, or to refuse to speak to you, or to run away into another room. As with everything else here, we need to treat each piece of information as part of a picture, and we can't leap to conclusions based on any one thing. Equally, we should be noticing it, and if we can't get any form of response or engagement at all, or if a child shows no attempt to seek comfort from a parent or carer, if they're young and obviously distressed, and a parent and carer is available, we should certainly be noting it. Obviously, when we talk about being passive and withdrawn, we may be talking about something we would call depression, which is perhaps more common in traumatized children than people realize. Self-harm is also a common internalizing response, and going back to the subject of clothing, long clothing, particularly long sleeves, are commonly worn to cover marks. Again, we shouldn't jump to conclusions, but it's worth noting how young people are dressed. When we think of self-harm, we tend immediately to think of teenagers, but it's more complex and wider spread than that. A common behaviour among children is to bang their head on a wall or something else when distressed, and bumps or bruises on the head are worth noting. Other areas of concern are, perhaps obviously, eating disorders, which are often a way of trying to control something in your world when everything else is out of control, and hence quite common in young people experiencing domestic abuse. Suicidal thoughts and attempts at suicide. These aren't necessarily things that can easily be spotted during attendance at an incident, but they are things to be aware of, and certainly areas where information needs to be passed on when they come to your attention. Externalizing behaviours are perhaps more immediately obvious and easier to spot. It's worth reflecting on the fact that although they often come out as violence and aggression, and often have to be dealt with quite directly and with the safety of others firmly in mind, they're still commonly the result of trauma and distress, and usually reflect the violence that child or young person has experienced. That doesn't mean we can always just let it play out when the behaviours are a threat to others, but it does need to inform how we respond. Where possible, we need to avoid direct challenge or confrontation and think about de-escalation and moving the situation on. In particular, we need to think about our tone of voice, our body language, and where the exits are. Our tone and body language can entirely change what happens next. If we're sharply spoken and appear tense and ready to jump in, it can easily inflame the situation. Whereas if we're more softly spoken and appear relaxed, we're less of a threat. Exits also matter. Although this changes slightly with the age of a child, most of the time we probably need to leave exits clear so we avoid inflaming a situation by making someone feel trapped. And if we're with a teenager or older child, attempting to stop them from running out will probably only result in someone being hurt. With a 5-year-old, much of this still applies, and if they need to run upstairs, they need to run upstairs. But obviously, they need to be prevented from running out into the street. Fleshing that out in terms of behaviours, and again, these might not all be things we can easily see, there's quite a list. It's worth being aware that the rejection of comfort or affection can both be normal, angry, toddler behaviour and teenager stuff, and it can also be a more complicated sign of something wrong. We need to think about risk-taking behaviours, which is partly what sexualized behaviour is, although it's also often a desperate cry for affection. We need to think about truancy and offending behaviours. Overall, it's quite a collection, but all behaviours we're more likely to see in young people who've experienced domestic abuse. We've touched on suicide attempts, but it's worth mentioning that again because it can be viewed both as an internalising and externalising behaviour. Some young people will attempt suicide multiple times, which is where the phrase "a cry for help" comes from. The danger here is that they may not be taken seriously, but every year, whether they mean to or not, some of them do kill themselves. As we said, we can't necessarily know or see this, but it does emphasise why our role in noticing and information sharing is so important. I don't know about you, but to me that's starting to feel like quite a lot of information, and we'll draw to a close in just a minute. However, before we do, I'm going to draw your attention to these two questions, then give a very brief overview of the support which schools are able to provide. Firstly, our two questions. These are simply useful, non-confrontational things to ask parents or carers whilst you're in the house. The first, how is school currently in touch with you, obviously helps you find out if they are in touch with school or if there is a lack of contact that needs to be addressed through subsequent information sharing. If there's no contact, that needs addressing. If they say they're meeting weekly with the school parent support advisor or another member of staff they trust, that's good. If the answer is I see their class teacher or tutor once a term or once a year, then that makes contact with the school after the incident and good information sharing even more important. The second question really relates to our situation at the moment with schools closed and the continuing partial lockdown. We know this has led to an upsurge in domestic incidents, and we know it's been dangerous and difficult for children living in those households. However, although some schools will be more able to help than others, all schools are still open and can offer places to children who are vulnerable or at risk. It's worth bearing this in mind, and without making any promise, finding out from parents if a school place would help, and then making sure that that information, their response, is passed back to school. Just before we finish, it's worth remembering what can happen following an incident where information is shared. Most importantly, school will be in a place to respond immediately, meeting that child when they come in the next day and paying attention to their needs. They'll also be able to start planning longer-term support where this is appropriate, making sure they have relationships with trusted adults in school, and helping them where necessary if other things such as work and peer relationships, both of which can be really difficult for young people when things are wrong at home, need supporting. School can also involve a wide range of other services which support both child and family, and hopefully in the longer term this results in a household where things change and get better, and where domestic incidents don't occur. Finally, and just to recap, think about the behaviours you see and what the home looks like. Remember those key questions. How is school currently in touch with you? Would a school place help? And please make sure the information you gathered is shared with school. There are thousands of children out there who have already benefited due to colleagues of yours sharing information and following the Operation Encompass protocol. And in the current situation with so many young people at home every day, it's never been so important. Thank you for your time, and if you have any questions, please remember that further information can be obtained from your force's police lead or from Operation Encompass directly.